Good morning then. It's my pleasure to welcome everybody to the second webinar in our project of changing research methods in COVID-19, emerging issues in changing research practices. We're here for a couple of hours, and if you're using social media, we've got the hashtag COVID NCRM. If you're retweeting or tweeting about the webinar, that'd be wonderful. So I should just say my name's Robert Meckin. I'm a Presidential Fellow at the University of Manchester and affiliated with the National Centre for Research Methods. And I've been working on this project with Professor Melanie and Dr. Andy Coverdale at the University of Southampton. Mel's been leading the project, and yeah, we're just coming to the end of it at the moment. So in the meeting, in the webinar, at the moment, everybody's on mute except for the panelists and for us, the presenters. That's due because we're recording. And I know everybody's already doing this, so thank you very much for using the chat. But if you have any questions or so on, please pop them in the chat, and Andy's checking through that as we go. At the end, for the last half an hour or so, we're going to have a discussion, and we'll turn off the recording and we can invite people to speak then, and we can have a more open discussion about what's been said through the webinar. So the way the morning is going to run is we're going to have about 20 minutes from myself, Melanie and Andy giving an introduction and overview of the project. And then we're going to talk about three main themes. So Mel's going to talk about making research happen. Andy's talking about making research ethical. And then I'll be talking about making research valid and trustworthy. And then we'll have a 10-minute break, about a 10-minute break. And then we can come back and have responses from our panel, who I'll introduce shortly. And then we can have our half-hour discussion and then close at about 12 o'clock. So I'd like to introduce our panel. We have, who I'm really pleased have said yes and agreed to participate in today's webinar. So we have Dr. Helen Cara, who's an independent researcher, writer and teacher of methods, and an evaluator of research as well. Dr. Yen Lee, who's senior lecturer in research methodology at SOAS at the University of London, and Professor Vernon Gale, who's Professor of Sociology and Social Statistics at the University of Edinburgh. So thank you to all of you again for agreeing. That's wonderful. And so we're part of NCRM, which is a UK-wide organisation funded by the Economic and Social Research Council, and NCRM delivers resources and a comprehensive programme of online and face-to-face training, including core and advanced quantitative, qualitative, digital, creative, and mixed research methods. So why this project? Well, we've all been affected by the pandemic professionally and probably personally as well. The social and physical restrictions which have made doing research challenging in the environment. And so we're interested in how people are changing their methods and practices to keep going, keep researching. And there was a lot of community activity, blogs and support, crowdsourced documents and so on. And lots of people will be familiar with Deborah Lupton's crowdsourced document, for example. So we're interested in bringing together some of the published research as well on methods that were emerging, methodological discussions that were emerging in the pandemic, and offering some sort of support and guidance as a way through these issues. So we conceived of the project Changing Research Practice, Undertaking Social Science Research in the Context of COVID-19. And the project was separated into two work streams. So we had a published evidence work stream and an engagement work stream. And those were to meet the two aims of the project, which was to synthesize the evidence available to the research community on how social research methods have been successfully adapted for or might work with the pandemic, and to engage the research community within and beyond the academy in learning and sharing positive methodological responses to and the constraints of COVID-19 measures when we're conducting social research. And the way that worked is we had the published evidence work stream, which was led by Mel, and Andy did a lot of work on the rapid evidence review and grey literature review. And then I was leading the engagement work stream, where we were sharing experiences and resources in a series of workshops predominantly, and these webinars part of that too. And so we had those all come together, and we're producing from all the data, the reports and co-produced resources, some guidance, and the webinars. And we were meeting every couple of weeks or so, and Mel and Andy attended all of the workshops, bar one. I think there was only one where we had just the two of us. So we were really closely working together all the time. And this is the NCRM page for the project. Well, this is the resources and rapid evidence review page for the project. I just wanted to pull this out because we've started populating this with the resource lists that we've been producing, that were co-produced in the workshops. And we've started producing some guides to particular problems that have emerged. So we have a guide to adapting interview practices and one to research in low and middle income countries. Excuse me. And the reason I'm partly highlighting that is because most of the references that you'll see today are 2020 from the Rapid Evidence Review, but quite a lot of the resources have references and citations that might be of use to over a greater time period. So I'm going to talk a little bit about the engagement work stream, and then I'll pass over to Andy, and who will talk a little bit about the literature review work stream, and Mel will finish off the introduction talking about the analysis. So we ran 8 online workshops through from September to December last year on a range of themes, from interviewing, participatory and deliberative methods, ethics, online ethnography, surveys, and secondary data. And we had a whole range of researchers engage with us. So we had 58 researchers. Some people came to more than one workshop, and from a range of methodological backgrounds, but also and interests and topics, but also from different sort of sectors. So we had academia, charity, government, and so on. And I know that we've got quite a broad audience today, so we're drawing on quite a wide range of engagement in that discussions that we have. One of the key activities that we did was a sort of a preparation activity that was intended to be an icebreaker, but became quite the sort of substantive part of the workshops, which was an adapted version of a method or activity for STEP Centre at Sussex, which is a metaphorical exploration of experience, and it's using the metaphor of a river. And we adapted this to the last year of research. So we asked researchers to represent their last year of their experience in a river, and then reflect on a few questions emerging from that. So we had all sorts of, we gave a few suggestions, but gave all sorts of possibilities for representing workshops. And we found it to be a really nice way to explore and talk about and have people discuss their challenges and experiences that they've had in research over the last year or so. And we'll be writing that up over the next few months. So I'm really looking forward to that. We have about 35 really nice diagrams and sketches and so on to look at. So just in terms of the data analysis that we produced, because that's kind of relevant to what we're talking about today, we had field notes. So both Andy and Mel recorded field notes, and I had a set of notes from facilitating the workshops. We recorded and transcribed the audio, and we have the images from the rivers. So which people so those have been loaded into NVivo, and we've been open coding the field notes for the topics that have been mentioned, and then recoded them with themes that came from the rapid evidence review for reporting. So that's the engagement work stream so far, and I'm going to pass over to Andy, who's going to talk about the rapid evidence review.
Yeah, thanks, Rob. Yeah, just a quick intro. So I'm Andy Coverdale. I'm Research Fellow at the Education School at the University of Southampton, mainly engaged with inclusive and participatory research with people with learning disabilities and digital accessibility. If you knock it on to the next slide, Rob, that'd be great. Yeah, thanks. So, so my main role with this project, as Rob mentioned, has really been working with Mel on the rapid evidence review. So, I mean, those of you who were here for the first webinar, I went through the literature search and the paper selection process in quite a bit of detail. So there's just a summary of that there for those who missed it. You can see the process that we went through. Well over 1,000 papers and down to about 60 odd at the end, where we did a quality assessment and detailed analysis and narrative synthesis. Next slide, Rob, please. Thanks. But yeah, I wanted to highlight today really on how we synthesized the key papers. We initially used 3 categories to organize our analysis, and you can see that them there. So we've got challenges, we've got solutions, and effectiveness. I guess these sort of reflected the rapid response and sort of problem-solving approach of what was being shared in the academic community in the early stages of the pandemic. And you know, there was limited evidence on the effectiveness of some of these adaptations and solutions, because it was sort of early stages in the reporting of these studies. And obviously there's, despite some quite rapid sort of publications, that, you know, a lot of the published literature was at that stage of catching up. But we did see some really good evidence and some really good reflection on the methodological sort of thinking and the, you know, the planning and that sort of decision making as well, which was really good. And that did lead us to sort of adding a complementary set of categories, which I guess added a bit more nuance and addressed the complexity in the literature and the shifts in the literature, some of those adaptations and the mitigating sort of effects of adapting to COVID and the pandemic situation and the constraints of COVID. And actually some quite creative and I guess quite opportunistic methodologies. We saw quite a lot of auto-ethnographic studies in particular. That was really, really interesting. So yeah, that. And I guess that those sort of decision-making, identifying key affordances, you know, have been, they've particularly informed our other outputs, which we are in the process of developing. We're developing some wayfinder guides, which we will be sharing on the NCRM website. Of course, we've, as Rob said, we've had that complementary search and synthesis of the grey literature reports, lots of really interesting blog posts. And then finally, I mean, these analyses helped us identify and develop key themes from which emerged 3 sort of overarching or core themes, which Mel will be introducing in a minute. But I think one last thing I would add is that we recently did an updated search and selection of papers since our first undertaking. And these do very much point to a rise, sort of an exponential rise in the volume of literature, which, you know, we would expect as the published literature, as I say, catches up with the topic and with the themes that we're looking at. And we certainly expect that to continue this year. And I think we're also seeing more new research with methods adopted and designed for the ongoing constraints of this sort of long tail of the pandemic, rather than those initial sort of rapid response adaptations or changes. And I think it will be particularly important for us to synthesize and share those, I think, moving forward.